Hello everyone, Adam Brown here. I've lived with type 1 for nearly 25 years, and now I work as a therapist, supporting people with diabetes in their mental health. And today I want to talk about a really important issue, which is diabetes distress. So many of us with type 1 are taught to think about it as a medical issue. What do you do with a medical issue? You take medication and monitor it. And this is how a lot of us think about type 1 diabetes. You go to your doctor, you follow what they say. That's how you deal with it. And as a therapist, I'm trained a little bit differently. So yes, I think about the biology of diabetes. There's hormones, there's things to monitor and manage and go to doctor's appointments. But also there's the psychology of diabetes. So how do you think and feel about your diabetes? What do you pay attention to? What motivates you and excites you in life? That's really important. And then there's also the social part of diabetes. So family, friends, work contexts, all of these things impact our diabetes. And as therapists, all of this is interconnected and influences each other. And so it's really important to understand, particularly the psychological and social parts of diabetes, which we often don't discuss as much in the diabetes field. So this is where the diabetes distress assessment comes in. It's something I have all my new clients take because I really want to understand, how do you think and feel about your diabetes? Where do you get stressed or burnt out or discouraged or stuck? And so it's a 30-item questionnaire, and it really measures some of these common feelings and worries and concerns about diabetes. So I'll just give you a few examples. I feel burned out by all the attention and effort that diabetes demands of me. I feel discouraged when I see high blood glucose numbers I can't explain. That one is often one I mark pretty high. I worry a lot that I could have a serious low glucose event. Really common experience. I feel frustrated about how hard it is to find good diabetes care. So there's 30 of these types of questions, and I think it can be a really validating experience to see them laid out because it reminds us that we're not alone in having lots of difficult feelings and thoughts about diabetes, because it is hard to manage type 1 diabetes. And so if some of this resonates with you, I really recommend talking to your healthcare provider about diabetes distress, and you can even go to diabetesdistress.org and actually take the questionnaire and see kind of where you're at. And I think it's important to do this because how we think and feel about our diabetes influences how we manage it. And then how we manage it influences how we think and feel about it. And all of that is connected to the rest of your life. And so it's really important to have a sense of where things are at. And I'm really glad to do this with T1D Exchange because we actually have a couple other videos planned where we'll talk about ways to deal with some of the distressing parts of diabetes. So really great to be here, and thank you for listening.